My name is Marisa Flores, and my project is titled This Cost How Much? 3D Printing a Cost-Effective Female Pelvic Ultrasound Phantom. My contact info is at the bottom of this screen and will remain at the bottom of all the screens if you want to find me on Twitter or email me any questions. So if it will move. I'd like to begin with my acknowledgements. First, I want to give a huge thank you to my Capstone committee, especially my mentor, Dr. Wilson, who gave me the idea for this project and then helped me all the way through it. My chair, Dr. Orr, and my third committee member, Dr. B, were also super helpful getting me through this, helping me with the process of forms. And then, of course, I want to give a huge shout out to the Modern Human Anatomy program, and especially my cohort of 2021 students who helped suffer through capstone anxiety with me. And then without InWorks at CU Denver and Children's Hospital, we wouldn't have any of the prints shown here today. So a little background is, what is point of care ultrasound? It's a standard of care for bedside diagnosis in most specialties, and it's because it's timely and creates an accurate diagnosis. And the training for ultrasound is starting as early as medical school and then throughout residency. Ultrasound is also way more cost effective than other diagnostic procedures. So a single ultrasound could cost anywhere about $370, where the same CT scan for the diagnostic would cost around $3,200. And training for ultrasound, we use ultrasound phantoms. What this means is we use a model that is going to replicate the view of what is seen in the live patient, and the views are fixed and easily replicated scan to scan. So that means that a novice scanner should be able to get the same exact view as an experienced scanner, and it's not going to change based on movement. And this is going to help with training and gaining practice of point of care ultrasound. So you can see here, this is an example of an on the market female pelvic ultrasound. So here they're doing a female pelvic ultrasound, and then here is a transvaginal ultrasound, which is a little more invasive procedure, especially if the resident or trainee is not as comfortable performing this. So phantoms help them gain that comfort, which in the end helps the patient feel more comfortable when this is being performed. Which leads to the rationale of this project. One, female pelvic phantoms are very expensive. So right here, you can see just on the low end, it's about $3,000, but on average, it's going to be around $7,500, which just makes it inaccessible for hospitals or individual learners to have many, if even one. And then the opportunity to scan on live patients is very limited. So in this study here, OBGYN residents were saying that if they had more exposure, more opportunity to do some phantom scans or scans on patients before they had to go out and do a cold scan on a patient in an ER or in an exam room, they would feel more comfortable. Which leads us to the hypothesis that 3D printed self-assembled female pelvic ultrasounds will prove to be an adequate and cost-effective resource for point of care training. So what did we have to do? First, we had to model what we wanted to print. So we used Rhinoceros 3D and Slicer 3D. So here we can see we modeled a ovary on either side and then our entire uterus. Right now we're looking at the outer layer, which includes the myometrium. And then within this, we went ahead and did another layer, which is the endometrium. So between our myometrium and endometrium, the densities change, which means their view under ultrasound will also change. And we had to do this from scratch because there's not a whole lot of cadaveric data that we could segment. And then as a housing unit, we went into 3D Slicer and segmented some data and modeled a just female pelvic bone. So then with the help of Children's Hospital and InWorks at CU Denver, we were able to print our uterus. And here you can see the different materials we used, which were different densities. So our endometrium is more dense, and then our myometrium. And then we have our ovaries, which have some support so that they weren't free floating while we were creating our phantom. And then we are waiting on prints from InWorks still, because printing a life-size pelvis takes a while. So we have this donated pelvis as a housing unit right now. Our phantom creation, we used soft tissue casing of a gelatin mixture. So this right here is what we came out with. It's opaque, so you can't cheat. You can't just automatically go to your uterus and ovaries. And the soft tissue is what helps the ultrasound scan. And then underneath is where you'll get the density difference. On the right here, this is what we're in the middle of trying to create with the pelvic casing so that it feels more realistic when you're scanning, because you won't just scan straight to the uterus and ovaries. And then under ultrasound, we were able to get a few scans. As you can see, our ovaries are pretty dense. And then here we can see just a little line of where our myometrium lays on top. And then this is our endometrium. So using the Butterfly handheld iPhone app, we were able to get these scans, but they're not as distinguishable as we had hoped, which leads to the discussion of, we were able to get a female pelvic ultrasound phantom model created. We used this perishable jello just so that we could get images and test our densities of our 3D prints to start. Overall, our model cost was only about $250, which means it's about 3% of market cost, which makes it very accessible for individual learners and hospitals to create. The setbacks here were that, one, our myometrium and ovary densities are very close. So when they're on scans together, they kind of blend in. And then another setback is that before we created our first model, we weren't really able to see what they would be like under ultrasound scan. And we had to kind of finick around with the densities between the soft tissue casing that we were creating and the different prints that we had, which leads to some future directions. The next step would be to create a ballistic gel housing in a mold that looks more accurate for scanning. We're hoping that we can get another set of prints done with our ovaries and our uterus so that we can get different densities that makes them more distinguishable between, one, their soft tissue casing and each other. In the future, we would hope to create more models. So we would want to see a 7-week in uterine pregnancy, an ectopic pregnancy, and then the ability for transvaginal scanning. And finally, we have COMAR approval to test the ease of use on students. So we would hope to see how novice scanners are feeling using our product. And that is our project. I'll take any questions.
Great talk. Wonderful, Marisa. Any questions for Marisa?
I'd like to ask Marisa to talk a little bit about what is ballistic gel and where do you find it, and is it easily accessed, and does it change the cost?
And how long does it last?
Yeah, absolutely. So ballistics gel, I found it just by Google searching. It's where I found it was the FBI training website, and they use it for bullet training. So it basically mimics the soft tissue of humans. It was pretty cost effective. That actually was already included in the cost of our model. So we have the ballistics gel. We're just waiting to set our model in it. So I think it was $75 for a big hunk of ballistics gel. And it should be able to just stay. It's not going to be perishable. We would use ballistics gel for its longevity, that we can just continue using it over and over.
Thank you.
Yeah.
Tanner asked if you have any ideas what materials you might use to change the density of the uterine model.
Yeah, so right now we're using a couple different 3D printed materials like Tango Black, Tango Plus, and our hope is that to reduce the cost of further prints is just to mix those to increase and decrease densities. I think the densities are like 0.1 and or like 0.16, 0.14, 0.15. So we would just add those together to increase or decrease density.